drivers have the need for cheese. Next, Rachel. Tomorrow morning at 10 on ABC 7.
There's a common misconception that darker or ethnic skin is somehow tougher and not as susceptible to issues like sun damage or skin cancer. That is absolutely false. So with us today to talk more about some of the unique skin care challenges facing people of color is dermatologist Dr. Jeanine Downie and one of her patients, Al Reynolds. Thank you both for being with us this afternoon.
Thank you.
Thank you, Sandra. So address that, this idea that, oh, it's dark skin, we don't have to worry about sunscreen, it's, it's strong. Not true.
So black can and does crack. So that's the first thing I want to say right off the bat. So we just have to put that aside. The reality is that our skin is also very sensitive to the sun in different ways. As African Americans, we have the least amount of skin cancer, we'll say, according to the Skin Cancer Foundation, of the general population. But our cancers don't get diagnosed as rapidly. So therefore, because they don't get diagnosed as rapidly, we have a greater incidence of morbidity and mortality. So we can die faster from something that we're not even getting that much of. Hence Bob Marley dying of a melanoma when he was roughly, what, 38 he was?
Oh, wow.
Is that because, are they not getting diagnosed as soon because people don't find them as fast as they should? They're somehow not as visible, or because people don't know enough about black skin or bother to look at the places where, melanoma might show up.
Right. So it's what you said. It's just misconceptions. It's thinking, oh, well, that person has dark skin, so they couldn't possibly have a skin cancer. Their skin is somewhat protected. I mean, having a tan, if you're Caucasian, gives you an SPF of 3. Having a tan, if you're African American, gives you an SPF of 5. Anything, according to our standards, the American Academy of Dermatology, that's less than a 30 is not enough sunscreen, and that's all there is to it. So the tan thing does not work and does not help at all. And having actual melanin in your skin is slightly protective, but not very protective. So it's a matter of patients not knowing what to look for. If you have a non-healing lump or bump or something on your skin that's not going away, and it's been more than 2 months, you should just get it looked at. If you have a mole that changes, it's asymmetrical, the borders are uneven, you should get it looked at. If you have something that's elevating, that looks very different from how it looked a couple of months ago, that's a concern. But
get
people
it looked at, no
aren't
matter
thinking.
who you
and
are.
So regardless of your ethnicity, you should wear sunscreen every day, at least an SPF 30, rain or shine, January through December. That's what I tell everybody. And everyone should get a full body screen once a year by a board-certified dermatologist. It's not good enough to go to your GP and have him checking your heart, in the back, Al, and then saying, oh, that mole looks like fine. Are you sure?
You
wouldn't want to come to me for your heart. You wouldn't want to, you have to just be smart about it.
And you also should think about your scalp.
Absolutely. We part the hair and we look all through the scalp too to make sure that there's nothing, lumps or bumps in the scalp as well. But it's a matter of patients not knowing what they're looking for, and many doctors just kind of thinking that black people are more protected than we are. And that's part of the fallacy and the myth that you were talking about at the front of the segment.
So let's talk about some of the, I guess, the more common issues that folks, especially people of color, come to you about: hyperpigmentation, and aging, like everybody else. What are you telling folks these days?
Well, so uneven skin tone is one of the main reasons that people come to see me, so that, I can help them. So I explain to people that when the light hits a beautiful woman, so whoever you think that is, Halle Berry, Angelina Jolie, Cindy Crawford, it's all about lights and shadows. So it's the way the light hits your face and bathes over your face and reflects from your face that either makes you look beautiful and kind of golden and glowing, or in turn it can make you look tired and worn depending on where the light is hitting you and where it's shadowing you. So it's all about playing up your lights and shadows, and that's just not with makeup, that's with your natural normal complexion. So when Al came to see me originally, he had a bit of an uneven skin tone, he had some eczema going on, and he just wanted help with anti-aging in general.
And you'd obviously gone to other dermatologists before, but she seemed to have, a better handle on dealing with your skin?
Well, I think she just has a better handle on dealing with her patients, I think. So it's just like her entire personality kind of seduced me to keep coming back, and then she kind of built out a plan for me. So I had like a skin management plan, which was something I never had, my first 35 years of living. I've been 35 for 10 years. But.
Yeah. Me too.
But
actually 20.
Like, you know, and I originally, I went to her because I did have like some eczema going on. And then you remember I had that scar. I had like a scar here that she just wanted it gone. So she really tried to, you know, created this treatment plan for me. And the best thing after she created the treatment plan was I started to learn the importance of keeping my skin healthy and moisturized, and how much that has helped me maintain a youthful look. And I go to her every month now.
And that moisture is important, because I think a lot of people think, well, if I've got rather oily skin, I don't need to worry about the moisture. That's not the truth.
That's not true. What you need to do is, if you have oily skin, is just use a more oil-free product. But you still need to hydrate your skin properly. You need to drink a lot of water. Al exercises a bunch. I exercise a bunch. I try to explain to my patients that how you exercise is going to boost your circulation, and that's going to wind up making your skin glow or not glow. So all of it's tied in together with good health. I tell my patients, if you're 120 pounds, that's 8 glasses of water a day. If you're 150 pounds, that's 11 glasses of water a day. So it depends how much you weigh, how much you should hydrate. And then I explain to my patients, in addition, if you pick at your skin, if you scratch, I had big patches of eczema, Sandra, when I was little, from here to here and here to here. This is one of the reasons I became a dermatologist, because I wanted to take care of my acne and take care of my eczema, because I was uncomfortable with the way I looked as a teenager growing up. And people would make nasty comments about me and my skin versus my siblings that I grew up with, and that just wasn't nice. And so I just wanted help with that.
So you're able, Dr. Heal Thyself.
100%. 100%.
Is diet much of a factor in terms of the quality or even the care of your skin?
Diet is somewhat of a factor. I mean, I explain to my patients that if they eat a lot of sugar, that can actually age their skin faster. So that's something that I don't advise at all. And sugar is also inflammatory, but yet I have a huge sweet tooth, so I explain everything in moderation. I don't recommend that they drink a lot of soda, that they drink a lot of sugary drinks in particular. If you're going to get your sugar, get it from a great dessert and then only have that, you know, once a week or that type of thing.
I'm going to send folks to your website just to find out some more information if they are interested, and find out a little bit more about you and the work that you do. It's imagedermatology.com.
Exactly.
Dr. Jeanine Downie, a pleasure to meet you. Al Reynolds, nice to see you.
Pleasure to see you again.
Thank you. We'll be right back.
Nothing affects your day like weather, especially severe weather, from hurricanes to winter storms. So bring your weather questions to